First, the headlines. AICC in charge Charandas heaps charges on BJP-led government, says government engrossed in horse trading. Rupees 50 lakh insurance issued to each of 921 doctors, health workers under PMGKY. Manipur Singh Wangjam confer AIFF emerging food. Hello and good evening, Kurumjari. You're watching the MAMITv English News Bulletin. I'm ALBINA RIAMEI. AICC in charge Manipur Bhakta Charandas has accused BJP-led government of wasting time on horse trading rather than focusing on managing COVID situation and saving lives in Manipur. The AICC functionary who arrived at Imphal yesterday on a 2-day visit to take stock of the internal crisis within Congress made the allegations at a press meet held at Congress Bhavan, BT Road today. He said Congress is prepared to face the upcoming elections and all internal issues of Manipur Pradesh Congress Committee MPCC will be resolved within 7 days. Chief Minister N. Biren-led government has imposed total curfew in the state as a measure to control COVID-19 situation, but has failed to provide any financial or food package to the people, Bhakta Charandas alleged. Mass vaccination program are widely held, but no RT-PCR test kits are provided, nor are there working ventilators at most district hospitals. COVID patients who are undergoing treatment at Jenims and Reams Hospital are also deprived of ventilators, he alleged. The state has not provided any compensation to the families of COVID victims. Chief Minister N. Biren Singh, who is also health minister, should make a public declaration saying that the state has failed to control COVID situation in Manipur and he is sorry, Bhakta Charandas contended. He also questioned why Prime Minister Narendra Modi has not made any statement on the current Pegasus spyware issue of India.
This government does not have any policy. Only they are busy to remain in government by any means, any kind of horse trading. This is human issue, sensitive issue to save the life of the people. Why are these ventilators not working in Reams and JNIMs? The entire state is under curfew for 10 days after months of restriction due to COVID by the BJP government in Manipur. Despite restriction, lockdown, containment and curfew, the BJP chief minister, who is also the health minister, has failed to bring down the daily COVID positivity rate under 1%. Except curfew, you have done nothing. Situation is so bad, nobody is coming out of. What has happened to the poor people, working class people? How they are sustaining? Are you giving any financial package or food package to them? The BJP government has not provided even a single penny as ex gratia compensation to the next kin of those who died due to the COVID in the state. Why is the BJP government not helping the family members of those who died due to COVID in Manipur? Why is the Chief Minister not providing RT-PCR test kits in mass testing for the people of Manipur? Under the present BJP government in the state, there is no hope of achieving 100% recovery from COVID cases under zero COVID deaths with zero COVID cases in Manipur. Why is the government of India, the Prime Minister, Mr. Modi, is not giving attention to the COVID situation of Manipur? We want to draw the attention of the government. The entire machinery should immediately, whatever measure is possible, the government should come to the help of the people of Manipur.
The meeting was also attended by CLP leader O. Ibobi, MLA K. Megachandra, CWC member Gai Khangam, along with other members of Congress Party. Insurance claims of Rs 50 lakh each were paid to 921 doctors and healthcare workers under Pradhan Mantri Garib Kalyan Package, PMGKY. Insurance scheme for health workers fighting COVID-19, Ministry of Health and Family Welfare announced. The life insurance scheme provides a comprehensive personal incident cover of Rs 50 lakhs to healthcare providers, including community and private health workers for COVID-19 related responsibilities who may be in direct contact and care of COVID-19 patients. The benefits under the scheme have been extended for another 180 days with effect from April 28. The ministry, being aware of criticality of human resources during the pandemic, has taken a number of steps to improve safety and well-being of medical officers and staff. With regard to COVID-19, the Epidemic Diseases Amendment Ordinance 2020, promulgated on April 22, was brought before the Parliament and passed on September 29. The amendment provides safety and security of healthcare service personnel (HSPs) from acts of violence. On January 16, 2021, with the launch of COVID vaccination program, healthcare workers were given first priority. The Ministry of Health and Family Welfare also provided guidelines on infection prevention and control practices to minimize risks of infection to healthcare workers. Indian football team midfielder Suresh Singh Wangjam from Manipur was awarded AIFF Emerging Footballer of the Year award for the session 2020-2021. The 20-years-old midfielder played his Blue Tigers debut against Oman in an international friendly match earlier this year. Suresh Wangjam also played in FIFA Under-17 Indian team in 2017. In a video message posted by the midfielder on Twitter, he stated, "It is an honor to receive the AIFF Emerging Footballer award and that this award will help motivate him and improve self-belief."
I am delighted at being named the AIFF Emerging Player of the Year. I would like to say a big thank you to everyone who has been supporting me and helped me to grow better. I will use this award as a motivation to work harder, and whenever I play I will give 100%, and this is a promise. Once again, thank you and stay safe.
As part of War on Drugs mission taken up by the state government, work for integrated project for plantation of rubber and fruit-bearing trees along eastern area border under supervision of Chief Minister N. Biren Singh has commenced. A meeting of Eastern Area Border Development Authority governing body chaired by CM N. Biren was held at Chief Minister Secretariat today. The meeting was also attended by Chief Secretary along with members of EABDA. Chief Minister Biren during the meeting said the integrated project taken up for eastern border area will also help improve livelihood of farmers of the area. This will further add motivation in War on Drugs mission, Chief Minister Biren added. The total curfew imposed throughout the state from July 18 continues effectively. A large number of police personnel deployed in Imphal East and West district areas under the respective SPs are strictly monitoring people from moving out of their houses. Movement of people and vehicles has been sparse across the districts. Police teams have been deployed at strategic points in the two districts to ensure that people do not come out unnecessarily. Policemen use loud hailers to inform people not to venture out without valid reasons. People who are not in the permitted essential services categories are detained and fined if they are found venturing out and warned to remain indoors. Even during the curfew, police collected a sum of Rs 40,400 as fine yesterday from different places. In Kaching district, security measures have been tightened under the supervision of SP Victoria Yenkom. Except for people who possess curfew permits, no one else is allowed to come out. Police personnel are deployed at Sora, Kaching Bazar, Palel, Hianglam, Kaching Kunau, Wangu and Suknu area of the district. With regard to the Chief Minister's COVID-19 affected livelihood support scheme introduced to provide livelihood to people who have been adversely affected by COVID-19, Secretary of Social Welfare Department Ningthojam Geoffrey has informed that incentives will be distributed to 8 categories under the scheme. The categories are street vendors, performing artists, labourers, public transport drivers, school van drivers, shop assistants, artisans and weavers. He further informed that the government will try to provide funds to people belonging to these categories affected by the pandemic. In connection with the scheme, it has been found that some individuals were reportedly selling unauthorized application forms for the scheme. They clarified that the Social Welfare Department has not issued any notice in this regard and warned the public to be cautious of such fraudsters. Jeffrey urged the people to report to the department if they come across such activities. Under the supervision of Imphal West District Administration, Samuro Municipal Council, Samuro Primary Health Center and Energetic Youth Development Organization jointly organized a COVID vaccination program at Samuro Market today. Around 200 people under the jurisdiction of Samuro Municipal Council got vaccinated during the program. Former chairperson of Samuro Municipal Council, L. Nonibala, Executive Officer of Samuro Municipal Council, L. Romesh, President of EYDO, L. Priyoranjan, MO of Samuro PHC, H. Rovi, and members of Amuko took part in the vaccination program. Imphal West District VDF Welfare Association has extended monetary assistance to BDF personnel Oinam Sanajauba of Pisumthong, Oinam Laikai, who was injured on duty. The association said the assistance was provided from the association's fund with the support of Superintendent of Police Imphal West, Dr. S. Ibomcha Singh. BDF Sanajauba had met with an accident when he was returning home after his duty at Imphal West Reserve Line posting on July 6. He has since been in hospital for treatment. COVID-19 Joint Task Force Paurabi has appealed to the authority concerned to declare Paurabi as a red zone after 44 people were found infected with COVID-19 within just 3 days. The new cases were detected during a mass COVID testing drive held at Paurabi, Lainingtho, Puthiba Community Hall on July 28 by a team of health workers led by Dr. Bikram under the supervision of CMO of Imphal East District, L. Indira. During the test, 6 persons below 18 years were found COVID positive. 6 persons who received the first dose of COVID vaccine were also tested COVID positive, and 34 people who had not received COVID shots also tested positive for COVID-19. Expressing concern over the increase of COVID cases in the village, Publicity Secretary of COVID-19 Joint Task Force Paurabi, W. Janmenjoy, appealed to the state government to take up necessary steps to control the spread of the disease in the area. Now we have a short commercial break. Stay tuned for more updates.
Adom Gilauda tin taba panbida laina laiba amadi adom na loibiriba sanga sing adu anai gyauruklaba matamda karamna ilomi hairiba website asigi khuthangda akhanghei tanagani. Ahanbada adom gi tin taraba lau natraga mahi marong sing natraga sanga adugi mayek yamna senglaba photo marikhak nambigadabani. Anisubada Google Pay natraga net banking ki khuthangda ekhogi consultation fee asi thibigadabani aduga fee adu thikre haibagi screenshot natraga transaction ID adu thabirakadabani. Mathangda adomna thengnabiriba awabasing haibadi tin taba panbida laina laiba amadi sanga da anai yorokpa adu khanbigadabani. Mathangda ming laifam isagi chahi lofamgi pakpa chawba loibiriba sanga gi masing amasung mahi marong sing adugi masing na chingba adu form asida menbiraba matungda adomna thengnabiriba awaba adugi maramda yamna kupna haivigadabani aduga photo sing amadi transaction fees thibagi screenshot adu photo hapam asida punna hapchin biraba matungda pau phaunaba yaba number ama hapchin biraga form asi submit button asida nambigadabani. Submit tawkraba matungda matam ikan kanadana aikhoigi akhang ahesingna adomna pibirakliba mobile number asida phone tawjaraktuna adomgi awabasing adu kokhanjagani. Lomi silinau singna awaba taraklaba matamda ningsing bigadavadi www.elomi.com ni.
Welcome back. India reported 41,383 COVID-19 cases and 507 deaths in the last 24 hours as per the data provided by the Union Health Ministry. A total of 38,652 patients were recovered in the last 24 hours, which brings the total recoveries to 3.04 crore across the country. India's recovery rate now stands at 97.35%. India's active caseload stands at 4.09 lakh and had administered a total of 22.77 lakh doses in the last 24 hours, which brings the total tally of doses administered to 41.78 crore. The top 5 states which have registered maximum cases are Kerala, followed by Maharashtra, Andhra Pradesh, Orissa and Tamil Nadu. About 77.3% of the new cases are reported from these 5 states, with Kerala alone responsible for 42.24% of the new cases. Maximum casualties were reported in Maharashtra with 165 daily deaths, followed by Kerala with 105 daily deaths. Congress MPs staged a protest inside the Parliament complex in support of protesting farmers and demanded that the 3 agriculture laws be withdrawn. Congress leader Rahul Gandhi and other leaders of the party participated in the protest. Congress MPs from both houses gathered outside Mahatma Gandhi's statue in Parliament complex and raised slogans against the government and the Prime Minister. Carrying placards and hoardings, they also raised slogans in support of the farmers and their demands. The Congress has been demanding the repeal of the 3 farm laws, which the farmers are against, alleging that these legislations will end the Mandi and MSP procurement systems and leave them at the mercy of big corporate. The government has rejected these apprehensions as misplaced. Farmers protesting over the contentious farm laws today reached Jantar Mantar in Delhi to hold demonstrations during the monsoon session of Parliament. A group of 200 farmers traveled to Jantar Mantar from their Singhu border in buses with a police escort. No permission has been granted to protest at Tikri border site. Farmers will hold protests amid heavy security deployed across Delhi. Police have tightened the security arrangements and also issued an advisory for today's protest. This is the first time since the January 26 violence in Delhi during the tractor rally that the authorities have granted permission to protesting farmers' unions to hold a protest in the city. The protest comes during the ongoing monsoon session of Parliament, which started on Monday and is scheduled to conclude on August 13. However, the farmers have received permission to protest till August 9. At least 3 different variants of COVID-19 have been newly detected from 75 COVID-19 patients in Mizoram, a health department official said. State Nodal Officer and official spokesperson on COVID-19, Dr. Pachwa Lalmal Soma, said that 73 cases of highly transmissible India's Delta variant and 1 each case of United Kingdom's Alpha and Eta variant were found from 100 samples through whole genome sequencing. He further said that about Alpha and Eta variants were reported from Aizawl district and the government is making massive efforts to find out the presence of any other variant of COVID-19 in the state. Quoting a study, Pachwa said Eta variant is more dangerous than other variants as 69% of the infected patients usually require treatment at the intensive care unit. Only 28 members comprising 6 officials and 22 athletes of the Indian contingent will participate in the opening ceremony of the Tokyo Olympics on Friday after the organizers suggested restricting the number of athletes attending the curtain raiser due to the COVID-19 pandemic. According to the numbers shared by the office of the Indian contingent at the Games, village hockey will have only 1 representative in men's team captain Manpreet Singh, who will be a flag bearer alongside boxer MC Mary. The march past will happen in the Japanese alphabetical order. India's number is 21st in the march past list as conveyed by the organizers. The opening ceremony of the Tokyo Olympics will take place in the Olympic Stadium on Friday. Before we wrap up, let's look at the top news headlines once again. AICC in charge Manipur Bhakta Charandas heaps charges on BJP-led government, says government engrossed in horse trading. Rupees 50 lakh insurance issued to each of 921 doctors, health workers under PMGKY. Manipur footballer Suresh Singh Wangjam conferred AIFF Emerging Footballer of the Year award. That's all for today. Thank you for joining us. Have a good time.